Third cholera pandemic. The third cholera pandemic began in 1852 in India, likely in the Ganges Delta, and spread through contaminated water to Asia, Europe, North America, and Africa. The rapid global spread was facilitated by trade routes and military movements. Symptoms included severe diarrhea, dehydration, and shock, causing over 1 million deaths in Russia alone and significant social and economic disruptions. Authorities responded by improving urban sanitation and implementing quarantine measures. Treatment focused on rehydration, although germ theory was still developing. This pandemic spurred the development of modern sewage systems, particularly in cities like London, highlighting the importance of clean water and sanitation and influencing the establishment of public health organizations. Russian flu. The Russian flu, caused by the H2N2 virus, began in 1889 in Central Asia and spread rapidly across Europe due to advancements in global travel and urbanization. Common symptoms included fever, coughing, and body aches, resulting in approximately 1 million deaths and significant social and economic impacts. Responses included quarantine, isolation, and supportive care, though the medical community was divided on the best treatment methods due to limited understanding of the virus. Some researchers now suggest the pandemic may have been caused by a coronavirus, a hypothesis gaining attention in recent years. This pandemic emphasized the need for better understanding and tracking of viral outbreaks and highlighted the vulnerabilities of an increasingly connected world. Spanish flu. The Spanish flu pandemic started in the spring of 1918, possibly in military camps in the United States, and spread globally through troop movements during World War I. Symptoms included high fever, body aches, and severe pneumonia, killing 50 to 100 million people and disproportionately affecting young, healthy adults. Despite its name, the pandemic didn't originate in Spain. Rather, Spain was one of the few countries to report openly on the flu due to its neutrality in the war, creating the false impression it was the epicenter. This pandemic had a unique demographic impact and led to significant advancements in public health policies and international cooperation. Asian flu. The Asian flu, triggered by the H2N2 virus, emerged in East Asia in 1957 and spread globally, causing 1 to 2 million deaths. Notably, the role of modern antibiotics in treating secondary bacterial infections significantly reduced the overall mortality rate compared to previous pandemics. This pandemic led to the development of the first significant global surveillance system for influenza, highlighting the importance of monitoring and rapid response to emerging health threats. Hong Kong flu. The Hong Kong flu pandemic, caused by the H3N2 virus, began in 1968 and led to 1 to 4 million deaths worldwide. The virus's evolutionary origin as a reassortment of avian and human flu viruses is particularly fascinating. This pandemic notably affected younger populations less severely than older ones, likely due to partial immunity from previous flu strains. The outbreak underscored the importance of international cooperation in flu surveillance and vaccine development. HIV/AIDS. The HIV/AIDS pandemic, caused by the human immunodeficiency virus, HIV, began in 1981 and has led to over 32 million deaths so far. A lesser-known yet critical aspect is the virus's complex relationship with social stigma and discrimination, which initially hampered public health responses. Innovations such as antiretroviral therapy have transformed HIV from a fatal disease to a manageable chronic condition, but significant challenges in access and stigma remain, emphasizing the need for ongoing public health efforts and education. H1N1 swine flu. The H1N1 pandemic, commonly known as swine flu, emerged in 2009 as a new strain of the H1N1 influenza virus, resulting in an estimated 151,700 to 575,400 deaths globally. This virus contained a unique combination of genes from human, avian, and swine influenza viruses, highlighting the complex dynamics of viral reassortment. The rapid development and distribution of a pandemic flu vaccine marked a significant achievement in global health response, showcasing the advancements in vaccine technology and international collaboration.
Zika Virus. The Zika virus was first identified in Uganda in 1947, became a global concern during the 2015 outbreak in Brazil. Transmitted mainly by Aedes mosquitoes, Zika is particularly dangerous for pregnant women, as it can cause severe birth defects like microcephaly. Symptoms include fever, rash, and joint pain, but many cases are mild and go unnoticed. The 2015 outbreak led to widespread public health measures, but Zika remains a threat in tropical regions, highlighting the ongoing challenges of mosquito-borne diseases.
COVID-19. The COVID-19 pandemic, caused by the SARS-CoV-2 virus, began in late 2019 and has resulted in millions of deaths and unprecedented global disruption. Beyond the well-known impacts, the pandemic has accelerated innovations in telemedicine, remote work, and vaccine technology, particularly mRNA vaccines. The pandemic also exposed significant vulnerabilities in global health systems and highlighted the critical importance of pandemic preparedness and response, leading to widespread changes in public health policies and practices worldwide.